name is Dr. Dolores Tarver. I'm a licensed psychologist here in Georgia, and it is time for the Tea Time with Dr. Tarver is a wellness based podcast. It is not intended to be a substitute for a relationship, but a licensed mental health provider. Welcome to March. Do you feel like you've been marching, and do you feel like it's some madness? All of those things, yes. I want to thank everybody who tuned in last month for our February series on navigating relationships, designing the relationships you deserve. We got into all kinds of information about relationship dynamics from dating to marriage to co parenting, divorce, starting things over, the healing. So if you didn't get a chance to check that series out, go back. Facebook, Instagram, YouTube, your favorite listening podcast stations, and make sure you check out those good episodes. I had some of the homies and homettes with me to celebrate those lives, and we had a good time. In March, we celebrate Women's History, right? So we are going to be talking this month about things that affect women, the things that are particular to our health and our wellness, and making sure that we're taking the best care of ourselves because we don't always do the best job of that. And I'm going to start this episode off with just an overview of some things. Definitely want to focus on what having the right team looks like when it comes to self care. That's the angle I'm going to be taking today. And then I'll get into some specifics throughout the rest of the month on particular issues that we'll highlight today. It probably doesn't take much for you all to think about a woman in your life who had some significant value to you. You probably have some really fond memories of someone who advocated for you or pushed you, challenged you, made you the person who you are today, maybe loved on you, was a listening ear, a safe space, maybe had a good meal for you, or slid a little something in your pocket, as my mama used to say, to keep the hanks away. So, if that woman is still living in your life, I definitely encourage you to write her a letter or send her a card, give her a call. Oftentimes, people like to connect with us in ways like that. But also, if she's a woman that texts, you definitely can send her a text message. If that woman who you have those fond memories of is no longer here in this physical reality with us, then I definitely encourage you to honor her by sharing stories about her, doing something to celebrate her memory, maybe something that you all did together or something that you've come to value or means something significant in your life today because of her. That woman for me, Dolores Del Tarver. Yes, that's my mom, and she named me after her. Our names are exactly the same except for our middle names, and she is what I call Dolores the original. She was 5 foot 2 inches of all kinds of stuff. She was going to advocate for you. She did not back down. She is one of the reasons why I don't like bullies and stand up for people today, and also want to advocate for people when I can. She is the person who taught me about faith. She is the person who I saw sacrifice not to her detriment, but sacrifice as a way of loving and honoring, and ensuring that we had better than she did. She is who taught me about family and friends. She is a person I saw battle um, illnesses and financial challenges and relationship dynamics and be able to navigate them and get through on the other side. So to be able to teach me how to have a voice, though we had to work on how I expressed it, I attribute to her. My ability to write, I attribute to her. My love for reading and experiencing and being able to ride in a car and take a trip and have some adventures comes from her. She's also where I learned how to be able to navigate a lot of different environments and where I got my sense of fashion and style from. She is the origin of the lady rules, and for her, I will forever be grateful. I'm at that stage in my life where I'm no longer in that place of sorrow when I think about her. I have definitely more good days and positive memories and laughter because of her. So this one's for you, Mom. Thankful for you. This episode, as we talked about, is going to focus, ladies, on, I would say, transitions in our lives. Now that I am about 6 months or so away from 50, I've had a chance to, get through the teens and the 20s and the 30s and the 40s. And I've also had a chance to be around people who are in the 60s and the 70s and the 80s and the 90s, right? You look at it different when you're in the middle of that versus when you're at the beginning of that. But there are some things that I feel like are consistent across the different ages, because some stuff just isn't tied to age as much as it may be tied to family of origin, as it might be tied to your medical history, your mental health history. Right, so we're realizing you can experience things at a variety of different ages. You may be in menopause in your 20s because you had to have a hysterectomy. You may be experiencing challenges with your menstrual cycle, with pain, with hair loss, with body changes because you experience uh, PCOS in your teen years, right? And so cysts have a lot of effects on our ovaries. You may be, because of genetic traits, dealing with issues with your teeth, and their structure, and some people, their teeth fall out. That was the case for my mom. She said her teeth, just, she was a teenager and her teeth started crumbling, and she's like, I drank milk, we did go to the dentist, so I wasn't right. But then you realize that there are just some genetic markers that can affect us, just like cancer. My mother had a significant family history of cancer. I don't think there were too many women on the maternal side that didn't experience some form of cancer. My aunt Courtney, who was our closest sister, brain cancer. My mom, breast cancer, that metastasized to her liver and her bones. Her mother had ovarian cancer. Right, so these are sometimes just like kind of a lot in life. I have, you all have seen me wear my glasses sometimes, my contacts other times. I've probably been wearing glasses since I came out the womb. I've always had impaired vision, and the older I get, the worse that vision has started to get. They told me, hey, it'll get to a point where it peaks, and then it'll start going another direction. You'll get to a point where you need some bifocals, some readers, if you will. That happened, but then it's like, okay, well, now I still can't see far away. That's getting worse. So those are the kind of transitions that a lot of people are dealing with in life. Hormonal changes can cause also problems with sleep. Hormonal changes can cause problems with weight gain or weight loss. You can have irritability and anger. There can be memory problems. A lot of times women are dealing with feeling like, hey, like, okay, I had bad menstrual cycles. When I had menstrual cycles, I had to deal with heavy flow or bad cramping. Um, may have had some fibroids, to now I've transitioned to menopause. Menopause is kicking my butt. I've been in menopause for a decade. That's not stopping, right? With the hot flashes and the menopausal belly that often women talk about. Like, why is my body not adjusting as it used to? I'm doing exercise, I'm eating well, and I'm still having all these problems. And then I think there is this fear too, regarding when we have the memory problems, because you can, when you're pregnant, you have pregnancy brain, you go through chemo treatment, you chemo brain, you have children, mommy brain, and you're dealing with grief and loss, right? And so there are so many different things that can impact our memory, and I think there is that concern about, okay, like, at what point is this, I'm at the place of no return. My memory is not only not going to get better, but it's not going to get worse. But it's going to get worse progressively. How do I know when I need to see somebody? How do I know when this is an issue I really need to be concerned about? Versus like, oh, hey, you just need to write stuff down. Like, you got to a point where you have to write stuff down and make lists, right? So being able to even understand when things are at the level where we need to see different providers. But I think also that there is that piece of grief and loss too that we struggle with, because like, at what point am I not progressing in grieving? How do I even grieve, and what does that look like? So is it affecting me in terms of anxiety and depression? Is it affecting me in terms of not being able to be as productive at work as I was? It is affecting me in terms of showing up for my partner or my children. So there are so many challenges that women are navigating and just trying to figure out, okay, what's a baseline, what's normal for me versus what are things that I need to be really addressing. There are times in your life where your vaginal health can change. I'm more prone to yeast infections or bacteria infections. Where is this coming from? We know that if you have cysts on your ovaries, that can interfere with you being able to have children, right? The fertility issues. But there are a lot of other factors that could impact fertility as well. Maybe you have successfully had children before, but now all of a sudden you're having problems with fertility or infertility that you haven't had to have before. We are also in the space of women and miscarriages and stillbirths, death of children, right? Spousal deaths, grandparents' deaths. The older you get, the more likely you're going to friends that you grew up with. You're going to see kind of just a range of loss, and it affects you different. It may have been okay. One may have hit me hard, but the rest of them have been okay. But now it's like I just can't bounce back. Um, we notice that the changes in the sleep could be affected with any of those things. And so, like, I'm having problems getting to sleep. I'm having problems staying asleep. I'm having problems with good quality sleep. It's not restful sleep. I may be having nightmares. Dreams may feel really intrusive. They may be very repetitive that I'm having them. I could have night terrors. Or there could be I'm sleeping a lot, like I'm constantly tired. I don't feel like I have a lot of energy. Feel drained even when I do get rest, because we realize that as women there are risk factors for anemia. So you could have low iron, you could have low B12, you can have low vitamin D, right? So see, these are some of the common deficiencies that women often have because we do have menstrual cycles, because we do have hormones, because we metabolize and process things different in our bodies, because we may have other things that we're experiencing, fibromyalgia, there might be arthritis, and again, not necessarily related to the later years of my life. There are teenagers and children that have arthritis. Again, that family history is really important. We don't always share that family history, so we may not even know what some of those risk factors may be. You may not know until you are trying to have children, or you may not know until um, you go and you have your first whatever exams, typically because there's a problem. And then there's some testing done, and you realize that you have some risk factors that you may not have even known that you had. But I also say that women in general have difficulty asking for help. Black women specifically have challenges asking for help. And some of this, right, is functional. So some of you may be the sole provider for your family. You may be the only person that's working. You may be the only person that's bringing in insurance benefits as a component of whatever your career has been. You may be the primary caregiver in the house, and so you're navigating the household. You may be managing all of the bills, making sure that things are taken care of. You may be the person that's grocery shopping. You may be the person that's taking all the kids to their appointments. And sometimes what ends up happening in those spaces is that we overfunction and other people underfunction, but also there just may not be anybody there to provide us any support. Some of us are in positions where we don't have family where we're living, and so we don't necessarily feel like we have that support resources. You may be new to an area, and so could be very uncomfortable asking for help. May have also had negative experiences with people before. Maybe there has been some violations in your life, and so you don't want to trust your kids with other people. You want to be able to be the one that's there with them all the time to keep them safe and make sure that they don't have the same experiences that you had. We also know that people's households are different, and so you might be like, I don't know what's going on over there. um, and so there are also these. You might be the person in the family who is the oldest. You may be the person in the family who's the most dependable. So there are all these roles that we are in. Some of them we go into willingly because they're areas we just happen to have a lot of practice skill, and so we naturally fall into that. But then what happens is whatever you start out doing in a relationship, whether that's work or with family or relationships, then people expect you to maintain that same level. And so some of us came in trying to prove ourselves, came in trying to be able to set a path for ourselves to be able to move up. And so we worked harder. We stayed there longer. We did a variety of different things. We learned a lot of other job responsibilities in order to make sure that we were well rounded, to be able to be considered for promotions, all of these things. And so then people begin to expect you to stay in that role. Some of you are sunshine in a bottle, and so people expect you to be perky all the time. And so when you're going through things, then I think sometimes we have received the messages like, suck it up, or you'll be fine, or um, people don't know how to be there for you because they're used to you being there for them. And so they will flip that thing around. They'll be talking about themselves and not show up for you. And so you're like, I'm not even going to bother asking because people aren't going to be there for me anyway, right? So it reinforces some of these perceptions we have about help being available to us. And what it means if we ask for help. Does it mean I'm weak and people are going to look down on me and see me as negative? I hear a lot of people talk about being a burden. Folks got enough to deal with. They don't have to deal with my stuff. But nonetheless, you take on all their stuff. So why is it you listening to them and supporting them? But the favor can't be returned for you. And the truth is that we don't want people to see us vulnerable. It's uncomfortable for us. And we fear that it could be exploited. We fear that it will be something that is carried around with us forever. We don't like looking broken or damaged in front of other people because unfortunately we've been taught that once you're broken and damaged, you're discarded, and so we don't want to be discarded. So we sometimes just don't feel like that's an option for us to be able to receive help. So I said to you that I was going to frame the strategies for this around self-care being get the right team together. And so that team is going to look like, it is very important for you to have baseline providers. I listed for you a variety of things, and I didn't even hit on everything that women deal with because there are just so many potential pairings of things that women are dealing with. Because most women aren't just dealing with a thing, they're dealing with multiple things, like you're caregiving. You might have an aging parent who you're caregiving for. You're navigating their properties and their finances, but you're also working and you have children, and you've got your own health issues, right? And so a lot of times because again, I did a podcast, that's probably some years ago. We're so used to suffering, we don't even realize we're suffering. We normalize these things, and it's like I'm stressed, but I just keep going until you get to a point where you can't, right? And so that's what we want to prevent. We want to prevent I just keep doing it and pushing through and ignoring and dismissing myself and my needs until a point where I can't ignore it anymore. And then at that point, now it's a severe situation where if I had addressed it early on, then I could have been able to do something to mitigate the potential impact on me long term. So that team has a baseline, right? So my baseline providers for women are your gynecologist, your primary care physician, your dentist, your optometrist, and if you see a gynecologist, usually they're going to have some connection with you also doing your mammograms, right? So I often put those two together because things that are considered women's health, they usually kind of follow up. But if not, then separately, you need to be seeing a provider to be able to do your mammograms. Now, you may be in a different phase in your life right now. You may have had some of the things that I mentioned before. You may not even have a menstrual cycle right now. You could have gone through treatment for some different things, and so you might also have specialists, right? But at the baseline core, yearly, preventatively, you should be getting your eyes checked. Twice a year, you should be getting your teeth cleaned and examined. One of those times should be x-rays. You should be getting lab work done. And I mean extensive lab work. I don't mean just, oh, we're going to look at your glucose and your your iron, but we're looking at those B12s. We're looking at that potassium. We're looking at your antibodies, right? Right. So there's a significant panel of testing that you can do, and your provider can help you navigate that. You don't have to figure that out on your own. But that baseline primary care provider is often the person who is going to be overall looking at your health and wellness. So as you're giving information to them, they're helping you create your team of providers. They may be helping you with those specialists. You can need a dermatologist, you can need a cardiologist, you might need a pulmonary specialist, you may need a dietitian. A lot of times we're dealing with gut health issues as women, and that's part of why we're having difficulty with being able to have the nutrients. And sometimes we're like, oh, I know what to eat, I know what to do. And we don't realize that that is not the primary role of a dietitian, right? So some of this is about understanding the changes that are going to happen. A lot of people talk to me about how their appetite changes as they go through different phases of their life and how they're maybe more or less eating as a result of that. That dietitian is going to help you navigate that. That dietitian also may be able to help you understand how your body is processing food and why it's affecting you in different ways. They may also be able to help you identify that what you're eating or drinking may be affecting your allergies, right? So there's a lot of different ways that that dietitian can show up for you. And so I think sometimes we'll exclude people because we'll think we don't need them, but it may be, and I'm a comprehensive kind of person. I think it's also important to have that homeopathic provider in there who may be able to talk to you about a wide range of treatment options, understanding the etiology of what is going on with you, because that's more important than you just kind of getting, medications or treatment recommendations for things. Is like, why am I experiencing these? And why has that changed? Why does that look different? Why is my body doing different things with the same stuff it's been dealing with for 10 years? Why did year 11 hit me different, right? So understanding that helps guide you in that treatment process. But also, I will say to you about this team is that they can help you find your other providers. They can help you be able to know whether someone is reliable or not, because I know that trust is a challenge with us. Sometimes it's transportation, sometimes it's insurance, your co-pays, what you have to pay, your out-of-pocket expenses, all of those things. But often it's about making sure that you're with a provider that can give you what you need, but also one who is going to see you, not be dismissive of you, hear your concerns, and be able to help guide you through possible options so you understand what your options are. But also, if you have questions or if there are things you want to be considered, that they will be heard and not dismissed simply because you're not an MD, right? But you are the person who knows the most about your body because you have been with your body your whole life. Also, I think it's sometimes we're very loyal as women, and so we don't like to switch providers. We feel like, oh, well, they've been, they saw my parents, they saw me. Sometimes you need to switch providers, and it's not that they're not a good provider or that they're not a good person, but they may not be the best fit for you depending on where you are in your life at this juncture. And so being able to find who's going to be the best fit for you is part of your self-care. So it's important for you to be able to access websites, to go to organizations, to get referrals from people, to better understand who may be some options that can best meet your needs, because you realize you're not getting any better with your current provider. And I even tell my clients in therapy, like, sometimes you need to switch it up. Like, you've been seeing me for some years, you may need to see another provider, particularly if there are things that someone else may have more of a specialization in than I do. And so it's important for us to be able to go see, even if you just do a consultation, because we hear the word specialist and it makes us so anxious and uncomfortable because we're like, I'm not that bad. That doesn't mean that you're bad because you see a specialist. What it means is this is a person who is particularly well versed in this area where you're having difficulty, and they may be able to see from a different perspective information that may be pertinent to you in your wellness and your care. So we want prevention, we want early intervention. We want to be able for you to be persistent. If you know something's wrong, you don't feel good. Because I know a lot of times people are like, oh, I don't find anything in the scans. There's nothing. And you leave there and you're like, well, what am I supposed to do? And you don't feel like you have any options. And here's your plug for therapy. Sometimes your therapist can help you navigate to what some potential options are. I don't want you to feel like you got to stop with a provider simply because they weren't able to tell you what was going on with you. That doesn't mean there's nothing going on with you. But it may mean that what they were utilizing to be able to understand what was going on with you might have not necessarily been the best fit, or that they may not have had enough understanding and information about some of the other things that you have going on that could put you in a category where it may look a little different for you. It's also important, sisters, that you rest, you recover. A lot of times we're having procedures done, we're going to work 2 days later. Make sure that you are giving your body, because as you're dealing with things, you're going through transition, your body needs more time. So yeah, you might have been able to bounce back in a couple of days 10 years ago. That may not necessarily be the case for you now. So making sure that you're giving yourself adequate time and rest to be able to recover. Particularly, and that doesn't matter if it's the cold, a flu, a procedure, you injured yourself, but making sure that you're taking that time and you're not just, we love to jump back into work. We're so worried about these jobs that sometimes it overtakes us and we're not taking the best care of ourselves because we're doing more work care than we are doing self care. And also, I will tell you that asking for help will allow you to be able to open up a variety of other options. That may be through a support group, that could be through support systems, the church, other organizations that you have where you're talking to other people who are experiencing similar things, so you don't see yourself as that broken damaged person that or that you don't deserve it. And so that you're following through on these recommendations, and some people that also have experienced some things and it's benefited them. I will also tell you to track your progress. Track when you start medications, track your side effects if you're having any. Track the changes that you're noticing after taking the medication. Track how the medications might be affecting other medications, how your food may be impacting, whether you eat or don't eat, the time of day you take it. All of these things are important because it helps your provider be able to better manage your care. And then also the advocacy of taking somebody with you to an appointment, I think is really, really important, right? As you set up your self-care and set up your team, because sometimes it'll be a person in there that can take those notes for you. There'll be a person in there who may be better versed in something, and so that can help you understand it better, and so it doesn't feel so overwhelming. Like when you're stressed out going to an appointment, anxious about whatever may be going on, that you don't hear everything. And so being able to have somebody with you allows you to be able to get some assistance when you have that gaps in your memory, you don't remember or don't understand fully, and maybe didn't feel comfortable asking questions. They may be able to do that for you. So women, in this month where we're honoring each other and celebrating ourselves, make sure that you're taking care of yourself by ensuring that you have the right team in place for managing all of the transitions and adjustments and things you're going to experience at various points throughout this journey of womanhood. Okay. All right. You all be well.